Also developing right now on Capitol Hill. The House putting the Ebola crisis under the microscope during a hearing to discuss the global health crisis. This is the second hearing in as many days. Just yesterday, President Obama announced the U.S. will send up to 3,000 military personnel plus equipment and medicine to the West African regions hit hardest by the outbreak. I'd like to bring in Dr. Michael Anderson, Chief Medical Officer of University Hospitals in Cleveland. Doctor, good to see you.
Good morning.
This operation could end up dedicating $1 billion to fighting Ebola. You have experience managing natural disasters at federal levels. Give us some insight into the planning and coordination required for such a massive operation.
Yeah, it's a great question. I think it's a great response. We've seen in disaster over disaster that infrastructure, that supply lines, that the basics of communication is really key to saving lives. There have been some wonderful organizations such as MSF, Doctors Without Borders, Samaritan's Purse. There's a great organizations really trying to save lives. But without infrastructure, without supply lines, without communication channels, you can see that this has really escalated beyond anybody's wildest nightmare. So I think this is a completely appropriate response.
And President Obama visited the CDC yesterday, classified the Ebola crisis as a potential threat to global security. How crucial is it for other countries, and you just touched upon that, other countries to participate in this fight?
Yeah, I think the president said it very, very well. It's important that America takes a leadership role. We obviously have wonderful resources such as the military for command and control, the CDC to help with biosurveillance, and the medical personnel to take care of the patients. But if other nations don't step up and either help the NGOs, the non-governmental organizations, or really supply troops and infrastructure themselves, I don't think it's going to be as appropriate a response.
And then there are the people that are most affected. In an exclusive interview with NBC's Kelly O'Donnell, Ebola survivor Dr. Kent Bradley talked about the difficulty of helping Ebola patients abroad. Take a listen to this.
The fear, especially around this disease, makes it hard for people to accept help from anyone. There are lots of reasons that people are scared, and so bringing in help from foreigners adds another dimension to that.
So, Dr. Anderson, how do you help people who don't want to be helped or may fear being helped?
It's a huge question. First of all, what a brave physician to go to a foreign country and to render aid, and then unfortunately to contract it himself. I just give him such credit. The second is there are a lot of cultural issues and fear. There's a lot of things to deal with. That's once again why I think infrastructure from America is important, but we've got to figure out how to equip locals, how to equip regional health care providers in taking care of their patients. We can't do it all, and I think that cultural issue is an important reason why we can't be responsible for everything. This has to be a truly international response.
Dr. Michael Anderson, so good to see you. Thanks for your time. Appreciate it.
My pleasure.
Coming up are 5 things, and Joe Biden is in Iowa, but the late-night comics beat him there. Iowa this week.